Hello, West Michigan. You are watching Alive and Well. I'm Linda Lear-Balkema, and today we are at the Mercy Health Lakes Village. Did I say that correct, Leslie?
Yes, absolutely.
Okay, we're going to talk about the Bladder Clinic today, of which Leslie is the director. And Leslie, tell our audience what your full name is and what your credentials are.
My name is Leslie Woldridge. I'm a certified geriatric nurse practitioner, also certified in urology and pelvic floor dysfunction. And we here at the Bladder Clinic offer a wide array of services, including assessment, evaluation of our patients, and we'll talk a lot about that.
Okay, well, it sounds wonderful, and she even has some props to show us. And for those of you watching at home, I'm sure many of you have been affected by this. We all, at some point in our lives, whether infants or adults, all ages are affected by perhaps bladder control issues. And we're going to cover a lot of those different issues today, how they're taken care of, what you can do, and how they can help you here at the Bladder Control Center. Okay, so Leslie, let's talk a little bit about, give me an overall view of what kinds of reasons make people come in to visit you first of all.
Sure. I think the most important thing that I want everybody to take away from this time is that urinary incontinence is not normal at any age. So It doesn't matter if you're 10 or you're 50, you're 90, it's not normal, and there are things that can be done about it. The sad thing is it's pretty well epidemic in the United States. About 33 million adults are affected by urinary incontinence, and only a small fraction of them actually get treated because they're either afraid to talk to their doctor about it, they're embarrassed, all those kinds of things. And so it's an important thing for people to know that there are treatments available for them.
Yes, and I think you're right. Embarrassment is a big issue for people, and we see more and more publicity about this. We see advertisements all the time for Depends and types of things for urinary incontinence, but it can affect any age. I had a friend all through high school. She would say to me, "Don't make me laugh because you know what will happen."
Absolutely.
So it isn't always just age related, though I'm sure that can affect and make it more prominent. Does you see more?
What happens with age is that there's certain changes that happen in our bladder that can cause problems to occur. The most important thing is knowing how to prevent it. It's just like having a baby. After pregnancy, after delivery, stress incontinence is a very common occurrence. And as we get older, there's certain things that happen to our bladder. Our bladder has fewer contractions, excuse me. It holds less urine, and we tend to urinate more at night, and that's generally because we lose one of our hormones in our kidneys that helps us to sleep all night and not get up to urinate. So lots of things happen. Women lose estrogen. Estrogen has receptors in our whole pelvic floor, in our vagina, our bladder, our urethra where we urinate out of. And what happens when that estrogen is gone is that those things just don't work right anymore. Our bladder becomes more urgent, our pelvic floor muscles become weaker, our vaginal tissues become drier, intercourse is more painful. So all those things happen naturally, but those are all things that we can do something about.
See, that's good to know, and I bet you there's some people sitting at home watching this thinking, I didn't know there was anything I could do about this, and I thought it just was something that happened with age or just something that happens to me, and that's not true. It happens to a lot of people. Now, you mentioned here in the United States, is it, do we have more just because we're a larger country, or is there something in our diet? Is there a reason where you have a higher incidence of this?
No, not necessarily. Actually, the incidence is very similar across all countries, across all ethnic groups, and it's just a really bad problem.
Okay, well, but you're here to help take care of that problem, and there's different. I've heard there are some surgeries that do correct this, right? A lot of women I have heard had bladder lifts. Is that correct term?
Well, yes, there are surgeries that can be done for the bladder, but the important thing to know is that our clinic is composed of 2 nurse practitioners and a registered nurse. We do not do surgery. We do all the things prior to surgery that everybody should really participate in, take advantage of prior to having surgery, because surgery is not the end-all to be-all. It's very important, very helpful for some people, but for most people, behavioral modifications can help, medications can help, pelvic floor treatments can help. There's lots of things out there that can help people prior to surgery. Especially one other issue that women have is vaginal prolapse. And that's where either the bladder's falling, the rectum's falling, the uterus is falling, or after a hysterectomy, the intestines are falling through the vagina, and people just get really scared and they freak out.
Sure.
They see this bulge, they don't know what it is, and they don't always get help for it because of that. But we have treatments that we do for it, especially if you don't want surgery. There are things called pessaries, and I have some to show you.
Oh, good. I want to see what a pessary is, because I have heard about this prolapse issue, and it is very common with women, and it would be very scary.
Yes.
It's nice to know it can be fixed.
Absolutely. Now, there's about a dozen different types of pessaries and about 8 sizes within each one. So I've brought some little show and tell things to show you. This is a ring pessary, and this is the most common type that we use. It's very soft. You just fold it, put it inside the vagina. It lifts the bladder, sits behind the pubic bone. You do not feel it. So you don't even know that it's there. All of a sudden, pressure's gone. It also supports the bladder neck. So there's seldom, it also is helpful for stress urinary incontinence, so that when the pressure is being pushed against the bladder, this pessary helps to shut that little valve off so we don't leak. So this is a very good thing. We have a lot of people who come and get fitted for pessaries that might leak only when they play tennis, when they play golf, when they run. So they take their pessary in and out for that.
This, I have to say, now any of you young women that might be watching wouldn't know this, but years ago there was a method of birth control called a diaphragm, and that's very similar to, has the same kind of concept.
Yes, it's very similar. It goes in a little differently. This goes that way. The diaphragm went up this way.
Oh, okay.
So that's what's different about this. This is an incontinent dish, and this goes in, and this little knob here is what gives the bladder neck even more support.
And you truly don't feel those when they're inserted?
No, you don't feel them at all. And the most important thing that women always worry about is, yes, you can have intercourse with these in.
Okay, important.
It's very important.
And your partner probably isn't even aware they're there.
Exactly.
No.
Your partner cannot even feel it.
Okay.
So that's good. This is a pessary that is used more for prolapse. It just fits inside the vagina, holds everything up, and then this little horn anchors it so things don't fall out. And you still don't feel it.
Seriously, because that one scares me a little bit.
I know, but even when you have a bowel movement, the stool just falls right down around it, and there's really no
from the pressure of the other side. This is an unusual thing to think about, but yeah.
But you know, so many women say to me, I wish I would have known there was something besides surgery to do for my problem.
Sure.
And there is.
That's good, because I have heard people that have had surgeries and it really wasn't effective for them, and they keep going back. So it's wonderful that this is here in Muskegon for you to come and get help if you need it. And it doesn't just affect women, correct?
Oh, absolutely. It affects men as well. And we do see men. We see men generally after prostate surgery if they have leakage. Let me just show you.
Which one do we've got the...
This is a picture of a male pelvis, and just real basically what happens during prostate surgery. This little nooger right there is their prostate, and this black area is their pelvic floor. And you see this pelvic floor wraps around their urethra, that is this little tube where they urinate out of. When the prostate is removed, a little part of the urethra is removed as well. Now, the surgery that the urologists do are nerve-sparing surgery, and they'll do robot or they'll do open surgery. And so the hope is that urinary incontinence doesn't occur post-op. For some men, urinary incontinence and erectile dysfunction does happen because the nerves are affected. And the question is, can that ever be fixed? It certainly can. We do 2 different treatments. We do biofeedback and we do pelvic floor stimulation, where we will stimulate this muscle to contract more. It squeezes more around the urethra and helps so that there's no leakage.
No leakage. And again, for men also, sexual function is very important to them.
Absolutely.
And prostate surgery makes that a very scary thing for men, but it doesn't mean.
Right, it
Right.
doesn't mean they have to be like that forever.
Right.
And men can get better up until a year after their surgery, and we've
Good to
even
know.
seen them after that. And it doesn't mean that everybody's going to be absolutely cured, but we teach them ways that they can control their incontinence, that they know how to, they know techniques where they're not going to leak, where they can control it, that type of thing. Our philosophy is not to show you what kind of pads to buy, but show you how to get rid of those pads.
That's a good philosophy. I'm sure that would make a lot of people feel better.
Yeah.
And knowing that they can. I see you have some other fun things here to show us.
Okay.
What is this?
This is my pelvis.
Okay.
And this is a female pelvis. And I think it's important for people to realize what kinds of things really affect urinary incontinence in the bladder. So this little yellow guy is the bladder. This is our uterus, the pink guy. And this brown
I
guy.
can only guess what that brown guy is.
This brown guy is our large intestine or
Okay.
our colon. And the importance of this is a few things. One, women will grow fibroids on their uterus. As the uterus gets larger, the fibroids get larger. What happens? They press against the bladder, and that can cause urgency frequency. When they get their uterus taken out, a lot of times that goes away.
Oh.
So, one of the other most common problems of stress incontinence, and stress incontinence is where the pressure inside the bladder is greater than the pressure in the urethra, and so we leak. We are built so that those pressures remain static, what they're supposed to be, and our pelvic floor muscle also helps control. Now, when the colon gets full of stool, what happens? It just presses against this, and when that colon is full and we're constipated, it's very difficult to empty your bladder. You have urine that's left over in your bladder a lot. It drips, it dribbles, it does all those bad things. And people just are frustrated and they're leaking and they have a bad time of it. So one of the first things that we actually do is fix people's constipation, and believe it or not, they're better.
Wow.
It's
Wow, that's
just
good to know.
that
That really
simple.
is. Yes,
Yeah.
fixing constipation could make it better. And that is another issue we're just hearing tons about on TV. Everybody's trying to do yogurt and things that are going to make their digestive system work
Right.
better. And it all is connected.
It absolutely
yeah.
is, yes.
Huh.
And so, there's a lot of things that are acute that happen in our body that can cause incontinence. We talked about as women get older and their tissues become atrophic, vaginal estrogen is a very, very helpful, safe remedy to use. There is a prescription that's needed for it, but
Is that a topical or is that a okay, so it's not a pill, it's a topical.
Topical.
Okay.
You can also, there is a pill called Vagifem that's inserted with an applicator. We have our patients use cream and we just have them use their finger and swish their finger inside. It sounds, but it works, it gives good coverage, and you don't have to clean those applicators that are not
Right.
clean.
Okay.
This is another preparation. This is called an E-string. This is an estrogen ring that goes in your vagina and sits there for 3 months, and it gets changed every 3 months. You don't even have to worry about it. It keeps your tissues soft, keeps a good blood supply to your tissues. Intercourse is very pleasurable, and you just change it every 3 months. So,
Okay.
and with men and their prostates, it's important to know that as their prostates enlarge, that enlarged prostate can cause irritable bladders. And so, it's important to have a relationship with a urologist if you have an irritable bladder and you're male. We don't do male bladder things because generally their problems result in surgery, and after surgery is when we see them.
That's when you can help them with
Yes.
their, well, that's important for the men to know. And I know that, I think it's generally about mid-40s, is it, that men start having maybe more urinary frequency where they're up in the evening several times, going
Yes.
to the bathroom, and they have that sense of urgency, or sometimes they feel like they have to go and maybe can't. I've heard of that.
Right.
So it's important that they go see a urologist. And after that,
Absolutely.
they come and see you.
Absolutely. After the 6th decade, every man's prostate will enlarge about 10% every year. So that by the time you're 100 years old, everybody's prostate will be enlarged and can cause some problems with urgency and frequency and irritative kind of symptoms.
Okay, well, Leslie, there's so much information here, and we're going to just take a little break, and we're going to come back and talk about all of the other things that they offer here at the Bladder Clinic.
City Glass and Mirror features glass for every purpose, servicing both residential and commercial. Their full-service showroom displays every aspect of what City Glass has to offer: handrails, closet systems, replacement windows, bath hardware, shower doors, and custom mirrors. They even offer auto glass and storefronts to see all they have to offer. City Glass and Mirror, located at 100 West 7th Street in Grand Haven and 631 Commerce Court, Suite 10 in Holland.
Welcome back, West Michigan. I'm Linda Lear-Balkema. You are watching Alive and Well, and with me is Leslie Woolrich, and she is the nurse practitioner and director of the Mercy Health Bladder Clinic. We are talking all about healthy bladders and what it means if you're incontinent, and that affects all ages, young, old. It affects men and women, all ethnicities. And so let's talk about what do you do for assessment? What's the first step in assessment, Leslie?
Okay, the first thing that we do when a patient presents, and a patient can present for any kind of problem, they might have leakage with cough, sneeze, laugh, they might have leakage with urgency, they might go frequently, they might have a pelvic prolapse, they might have pelvic pain. So we assess all those types of things. We have a 3-page history that we have everybody fill out. We also have them fill out bladder records, which are really the most important assessment piece that we do. That way we can see exactly when they go to the bathroom, if they had an urge episode, if they had a leaking episode, what they were drinking and how much. And then we can correlate what's happening, how much they're drinking, how often they're going. The interesting thing is that too often people will say to us, you know, I go to the bathroom 6 times a day now. It's just very irritating because I'm going all the time.
6 times doesn't sound like very much to me.
It's not.
Okay.
Normal is 6 to 8 times during the day, and a lot of people don't realize that. And it's funny because we always say if there weren't teachers and nurses in this world, we would be out of business. And also factory workers, because they don't get breaks, and people who don't get breaks and don't go to the bathroom don't realize that it is normal to go every 3 hours.
Especially if you're drinking fluids like you should be. If you're drinking your water,
Absolutely.
I think you're, of course, going to go more frequently. But yes, I've heard that for years about teachers. They don't take the breaks to go
Correct.
when they should.
Yes.
And they almost train themselves to
Right.
not feel the urgency, and then later that catches up with you, right?
Well, it does. And what happens with that is that your bladder can become boggy. And as we grow older, like we said, it doesn't contract well anyway. But if you an example might be if you had a pair of pants with an elastic waist and you kept that elastic stretched for 8 hours at a time without moving it in or out, after a while it's not going to go back. It's the same way with the bladder. It's a nice muscle that expands and contracts, and we need to let it do its job.
Sure, like any muscle. You need
Correct.
to use it as you should.
Yes.
Okay, so we do this assessment. People
Right.
keep a log and keep track of how
Right.
often they go, when they go, maybe the amount or how.
Right. So a good rule of thumb is that you should be going 6 to 8 times a day. If you are over the age of 70, getting up once a night might be normal. If you're over the age of 80, getting up twice a night might be normal. The rule of thumb is 5 uninterrupted hours of sleep is the norm. But then fluid is a very interesting issue with most people that we see. Number one, they drink too much or they don't drink enough. If you're only drinking a couple cups of fluid a day, what happens is that fluid ends up in your bladder in not very big amounts. It becomes very concentrated, and concentrated urine is irritating to your bladder. So people will drip all day. They'll have constant urgency, and they don't realize that that's a problem.
That's why drinking that water is important, right?
Absolutely. And on the other hand, if people are drinking too much, believe it or not, we do have people walk into our clinic holding a 2-liter bottle of pop.
Oh, yes. Yes,
And
soda's the wrong thing to be,
absolutely,
for a number of health reasons, even beyond the bladder.
Yes,
Soda's not the right thing to be drinking.
Diet Pop has a we call it the triple whammy. Caffeine, artificial sweeteners, and carbonation. All three very bad for your bladder.
Yes.
So we look at that, we take everything into consideration. Our rule of thumb is you need to drink at least your total amount of fluids, half of it should be water. Now, if you came to me and you said, you know, I drink a pot of coffee a day, I would have
me. How did she know that?
I would have to say, you know what, Lynn? A pot is just a little too much. Let's start with cutting it in half.
Yeah.
I'm all about quality of life, and that's really what we strive for. But quality sometimes doesn't always equate to what you want it to be.
I need to know, did you look at me and you could tell that I'm a caffeine drinker? I mean, I drink my coffee without sugar, true confession, but oh my gosh, I do. I have to, it's what gets me going in the morning.
Well,
people ask where I get my energy. I say Starbucks. No, it's,
and
is it in my skin? She knew.
No, but it is for a lot of people.
Epidemic.
And I would say too, you know what, Lynn, I get it. Have that cup of coffee in the morning, but do you really need the second one or the third one or the fourth one?
Sure.
You need to stop drinking caffeine after noon.
Okay.
Caffeine stays in our system for a long time, and it can affect our sleep and everything. So, you know, we look at all those things. We review people's.
The coffee.
And yeah, well,
and
you
the
know,
diet soda. Oh, I don't do diet soda. I rarely do regular soda, but it is just so unhealthy. And I know even with diabetics, which is a little off topic here, but they think they're healthy if they're drinking diet soda, and it's so unhealthy for them.
Right, and
So.
it's a good thing you brought up diabetics, because with diabetics, if their sugars are out of control, they're spilling glucose in their urine, they're going to have an irritated bladder. We can't really help them unless they get their sugars under control. And they need to listen to their primary care physicians and providers, because that's so important. The other thing that diabetics do is use a lot of artificial sweeteners. They're nasty on the bladder.
Yes.
So you need to really cut down on those kinds of things. And the truth of the matter is, what people don't realize is the more artificial sweeteners you take in, the less chances you are to lose weight.
Right. Yes, I've heard that. That's
Yeah,
true. People
that's
think
very
artificial
true.
sweetener is equivalent to using, diet pills. It isn't.
No.
They're not good for you.
We tell people, eat your sugar and count it.
Count it. Yes.
And be reasonable about how much you're eating. So, and we review people's medications. We go over lots of things, their history. How do you urinate? How often do you urinate? Do you have trouble urinating? Are you pushing to urinate? Pushing, bad news. No pushing. And so we talk a lot about how the act of urinating works for you, because it's interesting how many people don't know how to pee.
So there is a proper way to pee, and we're going to talk about the proper way to pee.
Absolutely is a proper way to pee.
Well, let's talk first about, we've done the assessment. So next, after the assessment, then do you start working on treatment?
Yes. In the first line treatment are behavioral interventions. Number one, we look at fluid management. We look at toileting management. How often are you going? We like people to go every 3 hours with or without the urge to go. So if you do not have the urge, we teach you proper toileting techniques. So Proper toileting.
Potty talk here right
Yes,
now.
we do. So when you're sitting on the toilet, you should be spreading your legs.
Wow.
You need to relax. Because when you relax and lean forward, your bladder falls forward so it's in proper alignment to empty. When you completely relax, your pelvic floor relaxes and your bladder contracts and you empty. When you start pushing, what happens is that here's your pelvic floor and you're pushing, pushing, pushing. It's like pushing a contracted ball against a 2x4. And so then you're still not emptying your bladder, but what you're doing is you're interrupting the bladder-brain connection. So the other thing that people say, well, you know, I was told to do my Kegels while I'm peeing and to stop my stream.
Yeah, stop the flow, I've heard that.
Okay, we used to teach that about 15, 20 years ago. I admit I taught it when I first started this business, but we have found since that that can cause what we call dysfunctional voiding. And then people don't empty their bladders, people have problems getting started, all those things happen. So the act of urinating is very important to just do it.
Okay, so all of you women out there that have been doing your Kegels, that you know what your Kegels are, those exercises for the pelvic floor. If you don't know, we'll discuss that too. But you don't do them when you're urinating, correct?
Absolutely.
Okay. Good to know.
And you don't push.
You don't push, okay.
Right, you
don't
just
stop your
relax.
flow and don't push, okay.
Correct.
Who knew? You know, there's all kinds of things that we talk about here on this show, but this is important to health, so I'm very glad that we're having this
really
discussion.
is.
Yeah.
Yeah.
Okay, so we've done the assessment. We just went over on the correct way to urinate, and we're going to talk about some other things when we come back. So stay with us, West Michigan, and you're going to learn all about bladder function and making your bladder be in control and healthy.
For years, people have put together photo collages for special occasions. They go through the photo album and old shoe boxes and pull out their favorite photos and put them on poster boards. The boards are a great way of sharing stories, but it can be a pretty tedious job. Well, we here at Clocks, we want to make that job easier for you. So just bring us all the photos and we'll scan them into the computer, and then we'll print out the collages on our large format printer. That way, all the photos will be in digital format so you can share them with your friends and relatives.
With 4 convenient locations, Jack's Corner Store is one-stop shopping at its best. Tools, fresh meats, produce, chips, snacks, and other grocery items, beer, wine, and liquor, even gas and lottery. That's why Jack's is your corner store and so much more.
Hello, West Michigan. I hope you've been watching us. We are talking all about the Bladder Control Clinic here at Mercy Health out at the Lakes. And Leslie is educating us all on a lot of things about bladder control, bladder incontinence, and how she can help you, and their whole team can help you. And we've been covering, let's see, assessment and treatment, and we were just talking about Kegels. So for those of you that might not know what a Kegel exercise is, Leslie is going to describe that and the proper way to do it.
Well, you know, it's real interesting when we assess people and do an exam, and one of the purposes of the exam is to teach Kegel exercises. So when we're doing a vaginal exam and we'll say to our patient, now have you been doing Kegels? Oh yes, and they don't work. So when we teach people to do a Kegel, we'll put our finger in the vagina, we'll have them squeeze our finger and see how they do. Then we sort of evaluate the level of strength, and we evaluate a lot of things inside the vagina. We evaluate where the bladder is, where the rectum is, we evaluate if there's any spasm, all those things, the condition of the tissues. But when we're there, we teach Kegel exercises. So let me just show you.
Here's the female pelvis.
Okay, so this is the female pelvis, and this is really important to know. Here's your pubic bone in front. This black area is the pelvic floor. It is a muscle that is like a figure 8. It goes around the anus, around the vagina, and around the urethra and back. So it's the same muscle, and that's something that people don't really understand. So when we're doing a Kegel exercise, what we're doing is we are squeezing this muscle. that is strengthening our anus, that is just about an inch right as our stool comes out before or after the rectum. And it also strengthens the lower part of the vagina and helps with prolapse. So if your bladder's falling into your vagina a little bit, when you strengthen this muscle, it develops a little bit of a muscular wall so that that prolapse is not as bad as it might be. And then of course it goes around the urethra, and on the urethra we've got two sphincters. We have the external sphincter, which is on either side of the urethra, and we have an internal sphincter that's right there that closes when we're finished urinating and opens when we urinate. So this is the muscle that we're working. So when you're doing a Kegel exercise, the most important thing you can do, of course, is relax. Then you isolate this muscle. You do not move your abdomen, you do not move your butt. Now, I'm doing a Kegel exercise right now.
I was just thinking, it's really hard to talk about doing Kegels and not actually do them. So.
Exactly, but the important thing is that you can't see that my body's moving.
Right.
I can do it while I'm talking, and I'm not really moving anything else. I'm just isolating that muscle. And there's two ways that we like you to do Kegels. We like you to work on endurance, and that's where you squeeze and hold. And we have you work up to squeezing and holding 10 seconds and then relaxing for 10 seconds. Again, the relaxation is just as important as the contracting, because if you don't do that, you don't know how to relax, and then you can't urinate properly.
I'm sorry, I can't help it. Follow everything she's telling me to do. It is a concentration thing. It's in your head.
Is.
And you know what, ladies? Don't be embarrassed by this. This is so important. If
Oh,
for
absolutely.
many years, and I think particularly older ladies, you know, as we age, I should say, there's a generational difference that they were taught many years ago. We just don't talk about these things, and it's very private. And I'm glad to see that times have changed and that we can talk openly about this. And obviously, anybody could come and talk with you about this
Absolutely.
very comfortably, because Leslie is, of course, you know, you don't make it embarrassing or a problem. It's just a fact of life. And know your body, and don't be afraid to get some attention here. It affects your whole life.
Yeah, and there's so many different techniques that we treat just by doing that contraction of the pelvic floor muscle. Because not only do we teach endurance, but we teach quick flicks, where you're going to teach you how to squeeze before you sneeze, squeeze before you cough. So those are really important. And as you do those quick flicks, where you just go squeeze, 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 squeeze 5 times and then relax. Squeeze, squeeze, squeeze 5 times and then relax.
These are things you can do at home, and this is important.
Absolutely.
Because there isn't a person out there that hasn't had a lady that hasn't had this happen with either a very deep sneeze or cough. I can
Absolutely.
tell you. We
Yes.
all joke about it at work, you know.
But
ooh, that was a deep one, you know. So
Yes.
these exercises can help. Tell them one more time what they can do at home to prevent this or to help gauge this.
Okay, so the important things is look at how often you're going to the bathroom, look at what you're drinking, how much you're drinking, sip versus gulp. Do your Kegel exercises every day, but do them when you're doing something else. Do them in all 3 positions, sitting, standing, and laying. Do them when you're driving somewhere, do them when you're standing brushing your teeth, do them when you lay down to go to bed at night. Those are really important things that you can do to make your bladder healthy.
Sure, and it's just a matter of thinking about them. You think about them, you're going to do them.
Absolutely.
Okay.
And
so-
those are so simple that everybody can do it every day of your life.
Good. Yes, and maybe you need a little sign up or a little reminder. If you don't want to put Kegel on your bathroom mirror for the whole family to ask you about, do some other, put a flower there and remember that's your Kegel flower.
Absolutely. Yes,
Reminder.
yes, you can absolutely do that. And we recommend them to do little strategies that are going to help remind them to do it and to
Okay.
remember.
So now there's some exercises and different things to do. We've done assessment and we've done some exercises. And what are some other treatment options that they may need?
Most of the things that we've talked about are for stress incontinence and urge incontinence. When you have urge incontinence, and that's where you get the sudden urge to urinate and you can't control it. And it also is classified as wet or dry. So people have frequency, where they might go 10, 15 times a day, and they don't leak, and that's urgency with frequency. Some people get up 3, 4, 5 times at night. That's urgency with we call that nocturia. And some people have urgency and they wet immediately, and that's urgency with incontinence. So urgency frequency can be treated with medications, and there's a lot of different medications. They come in basically two classifications. One classification where most of the medications come from are called anticholinergics. We like to stay away from some of them. Everybody wants their generic because it's cheap or it's free. But we really look at all the different medications. There's about 8 different ones in that classification. They have common side effects related to them in constipation, dry mouth, and blurred vision. So what we do is we stay away from the medications that have the higher % of constipation attached to it.
Because we learned earlier at the very beginning of this show is that sometimes constipation itself can be what's causing the problem with your bladder incontinence. Right. And so, as you said, sometimes it's just a matter of treating the constipation, and that in itself can take care of the problem.
Correct. And, you know, and being constipated is not a happy thing.
No.
And so, you know, so we look at that. The drugs have a little bit different action. They come from different places in our nervous system, so we kind of look at that. There's another classification of medications that helps with storage. So people who can't hold very much urine, we'll give that drug to them, and that's a good drug. It doesn't have a lot of side effects to it, so that's a good drug. But if we're unsure of what the diagnosis is, we'll do urodynamics in our clinic, and that's where we put a catheter in your bladder, a catheter in your rectum, and connect you to the computer, fill your bladder with water, see what happens to your bladder while it fills, see what happens to your bladder while it empties. That gives us a tremendous amount of information.
Now that's probably the scariest thing for you to hear, but if you're at the point where you know you have to do something and the other things aren't working, then it's nice they can do this. Now, I'm sure there's a little level of discomfort, but people are probably afraid that just the thought of a catheter is scary.
Right, but I tell people when you come to our clinic, we don't do anything that's painful. We don't have needles, we don't do anything like that. Yes, a catheter is sometimes uncomfortable, but the catheters for this testing are so tiny that, you know, you really don't feel it. And you know, people are quite surprised at how little discomfort there is during the test. And once the catheters are in, that's it. There's no discomfort, there's no nothing else that happens during the test. You just sit there and tell us what we want to know, and we're good to go.
Well, good to know that. So don't be afraid. And can you tell them, let's tell our audience how they could see you?
Yes.
What they do to come here to make an appointment? You
can call us. Most insurances do not require a referral, but if your insurance does require a referral, your primary care provider will need to call. Or you can self-refer, and you can call us at 231-727-7944. And we can make that appointment for you.
Yeah, what a wonderful service that's provided out here, and then the comfort and beauty out here at the lakes. And tell me a little bit, the pelvic control program?
Yes, we also are the primary and actually the only providers of the Total Control program in Western Michigan. And this is a program for women of all ages. And what it is, it helps with strengthening the core. We work on 3 major muscle groups: the abdominal muscles, the pelvic floor muscles, and the multifidus muscles, the muscles in the back. So what it does is it increases the strength of your core. It helps with urinary incontinence, it helps with nocturia, it helps with back issues, and it helps us sleep better. And the best part of all, it really helps with that intimate part of our life. And that's very important as well. We offer classes here 4 times a year. We just started a class a couple weeks ago. They're 7-week classes. They're $49 for the 7 weeks, and it includes a book. We also have generous scholarships that have been provided through the Women's Foundation here, the Women for Health Foundation here in Muskegon, who gave us a generous grant, and we provide scholarships for people who can't afford it. And with that, I'd like to plug our our Women's Gala event that we're going to be holding on September 17th at the Holiday Inn in Muskegon. Missy Lavender, who is the founder of the Total Control program, will be coming and talking to us. She was here 2 years ago and it was a spectacular event. We had over 250 people attend, and so we're moving to a bigger venue because...
And again, where is that?
It's at the Holiday Inn in Muskegon,
Okay.
and it will be on September 17th from 6 to 9 p.m. And you can call our clinic or you can go online. We'll have an online sign up
So
set
start
up.
planning now because
Yes,
you'll want to come out
absolutely.
there in September and hear Missy. I heard she was phenomenal last time.
She was phenomenal, and bring all your friends. And this event is really gearing towards women of all ages, teenage to older. And she's going to talk about her recent work on teenage girls and how much they don't know about pelvic health.
I think that is so important, and I'm glad you brought up teenage girls because even teenage girls have problems with bladder control and incontinence, especially a lot of athletes.
Yeah.
And different reasons, you know, whether they're running or jumping or, you know,
Right.
it can cause a lot of problems for everybody. So it's all ages of women. And like you say, pelvic health overall is very important. And the sooner, the younger you start that
Absolutely.
pelvic health, the better.
You know, we have a large group of women with pelvic pain, young women, teenagers through 80 years old. And the majority of them are in their 20s and 30s, and we have interstitial cystitis groups here that the meeting is held.
Now you have to say that one again. What is that called?
Interstitial cystitis.
And that's pelvic pain?
Yeah, it's a pelvic pain syndrome that affects women and men actually. We don't know what the cause is, but it causes lots of problems. It can cause urgency, frequency, pain with urination, blood in the urine, and it's a very debilitating problem. We see lots and lots of patients here with that problem, and we do offer the support group. You don't have to be a patient here to attend the support group. It's the second Tuesday of every odd month. And so you can always go on our website and find
Sure, and we will have that website running, and we'll have that phone number down below, because if you're experiencing any of these problems,
Right.
any bladder incontinence, pelvic pain, urgency, frequency, any of those things, don't hesitate to call, and don't worry, like you've said, even if you don't have insurance, we can work it out. There's some scholarships available for people who are eligible, so there's
Right.
not a reason in the world that you have to suffer with any of these symptoms and not get some help.
ASAP Auto Sales, located at 2486 South Getty Street in Muskegon, offers a wide selection of reasonably priced used vehicles from cars and trucks to vans, SUVs, and four-wheel drives. With new selections coming in every day, ASAP's lot is always full, which means whenever you drop in, there's about 100 vehicles to choose from. With a wide selection of vehicles, both domestic and import, they have it all. ASAP Auto Sales, 231-830-9000.
When your transmission is in trouble, it is important to find reliable and honest mechanics. National Transmission will get the job done right. Located at 4037 East Apple Avenue in Muskegon, you can call them at 231-788-3244.
Welcome back, West Michigan. You are watching Alive and Well. And if you have been with us, you know that we are talking about bladder incontinence and bladder control and all of the different things we can do to help you out here. But if you're just joining us, we're going to go over again some of the things that they do out here at the Mercy Health Bladder Clinic. And Leslie, talk a little bit, let's just kind of go over. We talked about Kegels, the exercises, and what are some of the other treatment options?
Well, one of the biggest things that we do is pelvic floor therapy, and it's helpful for stress incontinence and urge incontinence. We do pelvic floor stimulation. It sounds like, ooh.
Pelvic floor stimulation, it does sound ooh.
I know,
How,
but it's,
what is it?
well, we use a vaginal or a rectal probe. And what we do is we do an initial evaluation. We have you do some Kegels, see what your strength is, your endurance, and your technique. And then what we do is we have this probe that has a little metal piece around it. It sits in your vagina, and you just lay on the table for 15 minutes, and we stimulate your muscles to contract. What it also does is it wakes up those nerves that contract the muscles so that it will settle your bladder down as well as strengthen those muscles. So it's good for stress incontinence, it's good for urge incontinence, it's good for pelvic pain syndromes in that we can do some real high stimulation. It sounds like high stimulation, but you don't get sparked.
You don't get sparked.
You don't get shocked. Right.
I can hear a lot of jokes out there, but I'm going to
I
tell
know.
you, if you are suffering from any of these issues, this is real therapy that really works, and it's so important.
It absolutely
It's nothing to be
is.
afraid of.
Right. And we usually have around 6 or 8 treatments, and people start to get better around the 3rd or 4th, and it's really amazing. We also do biofeedback, where we just put some electrodes on either side of your rectum, and one on your thigh, one on your belly, and you sit in front of a computer and you look to see how you're doing Kegels. You basically compete with yourself. So there's no right or no wrong. But
You might as well have fun with it. You might as well.
Exactly.
Yeah.
Well, and we have all kinds of things that you do. We have earths that you can grow, and flowers that you can grow, and sunsets that you can do to relax. So we have lots of different things. So that's a lot of what we do.
Okay.
And then I think the most important thing is for people to realize that bladder problems most generally are chronic. We don't let our patients go. We treat urinary incontinence and urge incontinence as a chronic problem. We see patients ongoing for things. They get better doing some things, then they get worse once they just kind of wax and wane off their treatments. They come back. But if none of these treatments are working, there are third-line therapies for urgency, frequency, and urge incontinence, and we provide all 3 of those. One is the infamous Botox, of course.
Oh, okay. So,
And-
Botox
No.
for your bottom is the first thing I'm thinking of. Okay, so how does the Botox work?
Well, we do it in the clinic here. It's done through a cystoscope, where it's a scope that goes into your urethra, into your bladder. You're laying on a table. We anesthetize your bladder before we do this. You come an hour before the treatment. The treatment itself lasts a maximum of 10 minutes, probably around 6 minutes, and you get 20 little injections of Botox throughout your bladder, and that's it.
Wow. So you have a young bladder again.
Yeah, well, kind of.
Kind of how it works.
It takes
That's okay to the
right. It
Botox.
takes a couple weeks for it to work, and we don't do it on people with chronic urinary tract infections. We don't do it with people who can't empty their bladder, because we see those people too and teach them how to catheterize. We don't do it on those people. So we like to do it with people who we know are going to get a good outcome. The other thing we do is a treatment called percutaneous tibial nerve stimulation.
Well, don't even ask me to say that one.
Well, this is how about PTNS?
PTNS.
Okay, and that's what it goes by. We use a little tiny 34 gauge needle. It's about the diameter of a hair. It goes right into your ankle, right about here. It goes in just a couple millimeters. It's connected to a stimulator. And we turn it on and we look for a couple things. We look for your toes to fan. We look for stimulation in your heel or your foot, and it feels like your foot's falling asleep. Once we get that feeling, we know we're at a good millivolts, and we just start that stimulation. You sit in a recliner, somewhat like this, and you read a book, sleep, do whatever you like for 30 minutes, and then you're on your way.
Now, what does hooking these electrodes or whatever up to your ankle do for your bladder?
What it's doing is stimulating the tibial nerve. And your tibial nerve is right here. It goes up your leg into what we call the sacral plexus, and it meets up with the pudendal nerve that then goes to your bladder and your pelvic floor and relaxes everything.
Wow.
I know,
how
it's
interesting.
crazy.
No, but I always like to hear about holistic medicines or alternative medicines or anything to do other than surgery, or
Right.
as surgery is the last option is how
Right.
I believe. So I think that there's a lot of things out there that are as old as time that
Right.
are now coming back into, I hate to say vogue, but they've been proven to really work.
Right.
And so it's much like acupuncture and acutherapy, and you're finding out that nerves are connected to things. I think it makes perfect sense.
Yeah, it sure does. And it works. And that treatment is 12 weeks. You come in once a week for 12 weeks, and you start to see changes around the 4th or 5th week. And the changes are remarkable. People sleep through the night, they don't leak anymore, they're urinating normal times during the day. But again, people have to realize that it doesn't matter what treatment you do, you still have to be responsible for your own body. And I can't throw good after bad. So if you're not going to practice all the behavioral kinds of things that we've already talked about and gotten you to this point, that isn't going to work either.
Right.
So, and then there's some maintenance involved. And then the third line treatment that we would recommend is called interstim therapy. It's sacral nerve stimulation. It works the same as percutaneous tibial nerve stimulation, only there's an electrode that goes right straight through your back and through your tailbone, pretty much. And we do that first stage in the office, and that is there. You're hooked up to a stimulator for the weekend, and you plot what you do, not clot. And it works right away. So if that stage 1 works, then you go to the operating room and they implant a little device. It's about the size of a pacemaker in the back of your hip, right above your buttocks. Connect that wire to it, and it stimulates your nerves that go to your bladder continuously to prevent urgency, frequency, and urgent incontinence. And that treatment is also good for fecal incontinence.
Wow, that's another thing that we haven't talked about,
Right.
because this is the Bladder Clinic, but that is also something that affects numerous people. And these aren't the kind of topics that people talk about every day, or they're even comfortable talking to their doctor about. This is the place to come and talk about any
Right.
of this, obviously, because you are so. I want to ask a little bit about you and your training, because you certainly know the whole gamut of this. And what got you interested in this?
Well, I've been doing this for 20 years, a little over 20 years. When I was in my nurse practitioner program, I went through a rotation that was in a geriatric assessment clinic, and one piece to that was everybody had to go see the urogynecologist and the nurse practitioner and do a bladder assessment. And I thought, I don't know why they do that. I'm an old ICU nurse, so we like blood and guts, and we want things fixed up quickly and all that. So in the 4 months that I was there, I pretty much saw train wrecks come through there and walk out of there continent.
Oh, that's amazing.
And I was so amazed that this could happen that I thought, when I get out, that's what I'm going to do.
That's going to be your field of specialty.
So I started learning. I did primary care for a couple of years, learned a lot about how different chronic diseases affect the bladder. And that's the other thing, patients with Parkinson's disease, MS, strokes, diabetes, prostate problems, they all have bladder problems, and we can help them. And so I think it's important for them to know that.
It is. It's just amazing. I wasn't even aware of this, and there's so much that you can do here. We went over, we've got all kinds of visual aids. We've learned so much here. I hope that you've got a chance to see this segment from the beginning. And thank you for watching us, West Michigan, and we'll be back with you.
Beginning as a lumber company in 1911, Frederick's Construction has been servicing the Muskegon area since 1969. Family owned and operated, they specialize in roofing, siding, windows, insulation, additions, doors, decks, and more. Located at 1940 Commerce Street in beautiful downtown Muskegon, their phone number is 231-722-3937. When you want quality workmanship, you want Frederick's Construction.
Benson's Drug Company, the home of Benson's Bottom Pain. Offering an expanded grocery selection, Medicare billing, and diabetes management and education. Benson's now features a Kodak machine, which allows customers to edit, copy, and develop their own photos.
Well, it sounds like a lot of your experiences with the geriatrics or older people. You also have a partner. I know you work with people of all ages here, but you have a partner. Tell me a little bit about her.
Jen Mosier is a women's health nurse practitioner, and she does a lot with our younger women. She has a lot of years of experience in obstetrics and gynecology, and so she really brings the best. We work very well together because she sees women postpartum. So many women have problems with stress incontinence postpartum, and they just don't want to talk about that either.
Well, they've just pushed all of those muscles for crying out loud.
Exactly.
It takes a while to get them back in shape and do those Kegels and all
Right.
these important
And
things.
the ripping and all of that.
Yeah.
And so she does a lot of work with postpartum women, getting them back to shape faster. You know, the problem with women is we've worn pads all our life. So we just think, wearing
What's
pads?
another pad? Yeah.
What's another pad? What's the difference? But you know, it should not be that way. Pads can cause skin problems and on and on. So, you know, she does a wonderful job of working with those ladies. She does a lot of work with pelvic pain. She does a lot of work with our interstitial cystitis patients. She's a great resource to have and a great complement to what I do as well. So, you know, we see women of all ages, and she'll start seeing women at age 16.
Okay, and it's important to mention that you do sometimes see men as well.
Yes, we do see men. We will see men after surgery.
Usually after prostate surgery.
After prostate surgery, but we'll also see younger men who actually have interstitial cystitis, or men that have a frequency urgency problem. Once they've been evaluated by a urologist, and we like to work with our urologists because we're doing pelvic floor therapy with them, or we're offering them third line therapy. We might be doing PTNS with them, or we might be doing...
Now I have to stop you with the interstitial cystitis, which I think I almost said.
Yeah.
That again that's pelvic pain. Is that
That's
what it
pelvic
means?
pain, yes.
Okay. So,
And
for
you
any
know,
of you experiencing pelvic pain, male, female, anybody it affects everyone. It can affect everyone. So,
Right.
you know, this is a good place to come to. And obviously
Absolutely.
people are so well trained in this here.
yeah, and I think it's important to know that we see everybody. You know, don't be afraid that your insurance isn't going to be covered or whatever. I don't know that there's an insurance that we don't take.
Okay.
And so, and we help you with all of that as well.
And you mentioned earlier that sometimes, occasionally, you might need a referral from your primary care, but most often it's just accepted here. And then in the rare occurrences, there are some people that still don't have insurance. And if you don't have insurance yet, you need to go see the health project people with Mercy Health. But there are people that still don't have insurance, so you can even help some of those folks with no insurance, correct?
Well, they have to have some sort of payment.
Payment, yes.
And
okay.
so, and you're right. I think if they go through Mercy Health and that there are financial...
Yes, there's financial
aids.
assistance programs. There's all kinds of ways to get insurance. Now,
Absolutely.
There's not really any excuse for people not to have insurance, but if you need help with that, don't hesitate to call Mercy Health. They can put you in the right direction for that
Exactly.
also. Okay, so let's, as an overview and a wrap up, is there anything that we didn't cover? There was an interesting statistic that you gave me that a lot of people aren't comfortable talking about. So what is that? 1/3 of all people?
Well, I think the major statistics that people should remember is that 33 million people are affected with incontinence. So the threes. But then the weirdest, terriblest statistic is that 1/3 of people with urinary incontinence also have fecal incontinence, and we can help those people as well.
Okay.
So, you know, don't be afraid, talk to your providers, you know, they can get you help. We get referrals from just about every provider here in the Muskegon, in Grand Haven and Spring Lake area. So, you know, talk to your provider. There's a good chance that he or she has sent people to us.
Yes, and you know, with the fecal incontinence, that is a very embarrassing situation to talk about, as is bladder incontinence, but that just kind of magnifies it, makes it seem so much worse. But again, I think probably a lot of that could be related to diet
Yes.
or constipation and just balancing out. I think the way we eat now and the fact that we don't move as much as we did years ago, we have desk jobs, we're more sedentary. There's a lot of things that causes our digestive system not to work as it should.
Right.
And you can help with all of that.
Absolutely.
Okay,
So-
wonderful. Is there anything else that you would like to share with our viewers? So we can...
I don't think so. I think just, give us a call if you have a question about anything. We will see just about anybody that has a bladder problem, and it's simple, it's not painful, it's not embarrassing with us, and
I
so
can tell it's not embarrassing talking to you at all.
no,
You just-
we're easy. We
Yes.
we don't want you to feel like this. But if I leave you with anything, just know that incontinence is not normal at any age.
Okay, incontinence is not normal at any age. So if it's pelvic pain, bladder incontinence, fecal incontinence, any of those issues, don't hesitate to call and come out and see these wonderful people at Mercy Health at the Lakes.